So I have this lovely young couple here. We're going to talk to about basically the same issue, leading to the question of whether or not cannabis is a gateway drug to harder drugs. So first of all, did you guys want to give it your names or your age or where you're from?
My name's Jasmine. I'm 25 and I'm from the Slocan Valley.
I am TJ Riot. I am 27 and I'm from Kingston, Ontario.
Kingston, Ontario. So starting with Jasmine, when did you first start smoking cannabis?
First time I ever tried it was when I was just about 13. There's a lot of it in the Valley that I grew up in, so that's pretty normal for this area. But I actually started smoking on a daily basis at probably 16 or 17.
Okay. And how much do you smoke now?
Now I smoke intermittently. I was smoking every day, but only in the evenings, and it would only be maybe a joint or maybe a half a joint. Now it's actually once every 2 days or so, actually, more so. I've been taking some days and breaks in between, and I usually don't smoke in the morning. I usually smoke it in the evening as your nightcap. Some people have like a drink. I'll just smoke some of a joint instead.
And TJ, when did you first start smoking cannabis?
Probably around 17 years old.
And how much do you smoke now?
Absolutely none.
Don't smoke any now?
Not really, no. The occasional one, odd puff here and there, but
really not?
No.
Okay. So have you guys tried other drugs?
Yeah, definitely. Tried quite a few other drugs.
You don't have to get into details.
Like hallucinogens particularly, and yeah. I started trying those at a young age too, because there's a lot in this area. It's very common to have psychedelics.
Yeah.
And some of the milder chemical drugs in this area, for sure. It's kind of it's readily available, just as much as alcohol or weed would be. So yeah, definitely.
And TJ?
What was the question again?
Have you tried other drugs?
Yes, definitely. Around age 14, started with ecstasy pills without even smoking weed. Cigarettes first, then ecstasy, then someone introduced cocaine into my life. After that, I then became addicted to heroin and completely dependent on it, and through an acid trip and weed after, much after I got addicted, it basically got me off the drugs.
So the cannabis got you off the drugs?
Yep.
Okay. So the question of, did cannabis lead you to try other drugs? For you is an obvious no.
Absolutely not.
Because you've already tried the other drugs.
Harder drugs first, and then the weed is something that helps deal with all the withdrawals, especially from heroin, the physical dependency, and what it does to your body. The weed helps cope with all of it.
And what about you, Jasmine? Did cannabis lead to other drugs, or would you say that it had nothing to do with consuming other drugs?
I would say that it didn't necessarily lead to it at all. The reason why I tried cannabis at such a young age is because I live in a valley where it's grown very commonly. Right. So it's a very easy thing to get access to. Now, depending on where you live, different drugs are going to be easier to access, and you'll probably do the ones that are easiest to find first. Yeah. So, no, I actually don't think cannabis led to me trying other drugs at all. I feel like because it was the first thing I tried, it did show me that you can have an altered state of consciousness, but only in that way. Like, I could have tried mushrooms first and it would have shown me the same thing.
Right.
Yeah.
That makes a lot of sense. So do you think it's a good thing in your life?
Yeah, I believe that it's medicine. I actually believe that not only does it have many, many physical benefits as far as relieving pain, like giving you hunger. Let's say I get stressed out and I don't want to eat sometimes. Well, if I smoke a joint and wait half an hour, I'm going to get really hungry regardless of how stressed out I am. For people who have sleeping disorders, it helps them fall asleep. It's an amazing painkiller, especially when you eat it, particularly when you eat it. I've seen people come off of surgeries and be eating marijuana instead of taking the pills that the doctors want to give them, and it has just as good of an effect. And for me personally, I believe that it's very healing mentally too. Like I really feel like when I smoke a joint, just even a couple puffs of it, I will all of a sudden know what it was in my day that I was struggling with and how it was affecting me, and I'll actually be able to kind of rewire the way that I'm thinking and looking at it. Also, as somebody who struggles with anxiety, it helps me to kind of organize my thoughts sometimes. Like take a minute, like my brain moves really fast a lot of the time, and actually when I just slow down just a tiny little bit, it allows me to kind of heal mentally as well as physically.
Excellent. And it would seem to me that if we had people sitting on this couch and we were asking about alcohol, cocaine, meth, heroin, every single one of them would say it would be, if I asked them the question, is it a good thing in their life? I don't think anyone would say any of those drugs are. So would you agree that it's completely different experience than those other drugs that are?
Yes.
Absolutely. In my opinion, the thing is like, it is medicine. And one thing that a lot of people will say is, oh, it makes you apathetic, oh, it makes you unmotivated. Well, I really think that it actually just amplifies whatever you are already. If you're already an unmotivated or apathetic person and then you smoke a joint, well, of course it's going to make it a lot easier for you to sit on the couch. Now, if you're a really motivated person and you smoke weed, you're still going to be motivated. It doesn't change that. And I feel like, honestly, I really do feel it's beneficial, absolutely, in my life. I feel like it's beneficial in a lot of people's lives. I feel like it not only allows us to have a medicine for all of these different physical symptoms that we feel from all these different diseases, but it also allows us to open up our minds too and just relax a little bit.
All right. And how do you feel about that? Is it a good thing in your life when you smoke it, or is it something you just avoid? And if you do avoid it, why do you avoid it?
I avoid it when I don't have any physical pain or no stress, because it just gives me anxiety and my mind runs too much and I think about things that are just going to stress me out and aren't necessary to think about. THC I really don't like on a normal use. CBDs I have been taking because I fell 2.5 stories and it's helping my brain recover from the brain damage I occurred. It also does cut my anxiety down because I'm not getting the psychoactive from it. And also when I fell 2.5 stories, I woke up and without my permission the hospital was pumping hydromorph into me, which is quite stronger than heroin, and it's been 8 years since I've last touched heroin, and waking up from a near coma and basically being forced to be addicted to an opiate again. My friends took me and to their house and took my prescription pills for hydromorph, which were 63 milligram pills, which is a lot. It's basically I would have became a heroin addict yet again, but my friend had his green card, and I was very fortunate for him to come out and shove Phoenix Tears down my throat.
And what are Phoenix Tears?
Phoenix Tears, as far as I know, is a concentrate of marijuana,
It's
a
like
very
oil,
potent
THC
one.
oil.
And if you don't smoke weed and your friend shoves a whole vial in your mouth, and if you're going through dope sick, it's the greatest thing because it knocks you out. I was puking for about 24 hours, couldn't even keep down water. That's when you withdraw. And because they took me from the hospital and they unhooked the IV, I was going through physical withdrawals, which weed doesn't do. So what it did was it basically knocked me out until my body could basically pass it through the system.
Let you sleep.
It let me sleep
let you
and
eat.
recuperate.
It let you not feel the pain that you were going through.
I had metal
without
put in my
having
arms.
to take a more toxic chemical into your body, and when you stop taking it, it just stops.
And I smoked weed for about a week at his place, which helped my appetite coming from the hospital. It helped with the pain of my arms, accepting metal in my arms, and because they were rejecting and stuff. So it helped me through the pain of all of that, and I got through with it with smoking a lot of weed and eating and ingesting a lot of weed. So I'd say for those cases it is an amazing thing, and it was very lovely to have around.
Something that might confuse people is that for you, Jasmine, cannabis with THC in it relieves anxiety, whereas for TJ, it has the opposite effect and brings him anxiety.
Yeah.
So a lot of people don't understand why that's the case.
Certain strains don't. She gave me a strain once
It depends on the strain, and it also depends on your day. So in my opinion about that is I have anxiety, and yes, I've had weed increase my anxiety. But the thing is I believe that your mind has a muscle memory, and let's say that I'm having a really relaxed day and I'm calm, and then I smoke a joint, well, I'll probably be calm. Let's say that I've been stressing out all day and my brain has this muscle memory of being in a stressed out place, and then I smoke a joint. Well, it's possible that it could definitely cause the anxiety in that case too, but I really don't think that it's creating anything. I think it's kind of just amplifying what's already there in a way.
Okay.
So also, different strains. Indicas tend to be a lot better for people with anxiety because they are less of a mental high. They're more of a body-oriented, kind of fuzzy, floating on a cloud feeling, whereas a sativa is a bit more of a mental high, so it starts to change the way that your neurons are firing, the way that you're thinking, the way that you're perceiving things, the way things look. So depending on what mixture you are smoking, it's going to have a different effect. Also, everybody has a different neurochemistry. Everybody's brain is completely different, so everything's going to affect them completely different than the last person. You can't expect one thing to work for everybody.
Right.
Otherwise, we'd just have a non-anxious strain, you know, and then everybody who had anxiety could smoke that one.
Yeah. Well, that makes sense. All right. Is there anything else you guys want to say in this interview?
Hi, Mom.
Marijuana is the best medicine that I've seen anywhere. And I think that
Agreed.
the fact that we're not allowed to have access to it is
And access to
absolutely
alcohol.
ridiculous. It's ridiculous.
Mhm.
It
All right.
doesn't make any sense.
All right. Well, thanks, guys.
Thank you.